Public hospital wards will not be set aside for COVID-19 patients as Singapore learns to live with the virus. Now, the move aims to shorten waiting times at emergency departments and ease the workload on healthcare workers. Lauren Ong with this report.
Every day, some 2,100 patients go through emergency departments at Singapore's public hospitals. It's a 16% dip before the pandemic hit. Now, waiting times for admissions are also longer than usual. It could take more than 2 days during an infection wave. Health Minister Ong Ye Kung says it's all because of high demand and low supply of hospital beds.
It's not very different from an expressway with very heavy traffic flowing. All it needs is one branch for on one lane or half a lane, and you have a massive traffic jam.
There are also other reasons for the bed supply crunch. Construction of new hospital care facilities and nursing homes were delayed, and more senior patients needed longer hospital stays. Beds set aside for COVID-19 patients also added to the shortage, but such a scenario is set to change.
Hospitals will no longer set aside whole wards to cohort COVID-19 positive patients as a standard pandemic practice. They will continue their current practice of using isolation beds for patients with infectious diseases, including COVID-19, if there's a risk of infection spread.
Mr. Ong says while fewer people showed up at emergency departments, those with serious conditions increased, and this added to the workload of healthcare workers.
What's the estimated backlog for the elective elective surgeries that we are currently facing now, and what is MOH doing now, and when will we clear this backlog?
Ever since we moved to start opening up, hospitals have all realized that to postpone electives and postpone non-urgent surgery, actually it all comes back. After a while, we have been very reluctant to postpone these electives. In the recent way, we postponed some, but only 5%, 10%. So it's not a huge backlog, and certainly we will want to clear it as soon as possible.
Mr. Ong says solving the bottlenecks at EDs can greatly help the situation.
How is MOH supporting our healthcare workers to do their work more efficiently and to prevent burnout during this period of high patient load?
How to prevent burnout? If we solve all these jam problems, manage pandemic, and move to an endemicity form of operations, I think it will go to a great extent to reduce the workload.
Mr. Ong adds that solving these issues can also help give adequate attention to the elderly during long waiting periods, a concern raised by MP Joan Pereira.
Another move to free up beds centres on transitional care facilities. Patients waiting to be discharged or transferred could soon be moved to such a facility first. Now, 2 more tie-ups between TCFs and public hospitals are in the works. New facilities in the northern and western regions are also on the cards. Lauren Ong with this report.
It's just a short stop for some patients at Sengkang Community Hospital's transitional care facility. They are waiting to be discharged or transferred to other immediate or long-term care facilities. More TCFs are being planned as the Health Ministry looks to free up beds in hospitals that provide acute medical care.
TCFs are not just about providing bed space that's operated by private hospitals. There has to be a very firm handshake between the TCF operator and a public hospital. Because with that firm handshake, the privately operated TCF will gain confidence in admitting patients transferred by a public hospital, because they will feel assured that should they need any clinical help, in the unforeseen circumstances, there's some complications, the public hospital will still step in.
Mr. Ong says this community hospital has a solid partnership with the neighbouring Sengkang General Hospital, which caters to patients with more serious conditions.
We will replicate this to pair up Changi General Hospital with Expo Hall 10, run by Raffles Medical Group, Tan Tock Seng Hospital with Crawford Hospital. We are actively working on new TCFs in the north and in the west to partner Khoo Teck Puat Hospital and Ng Teng Fong General Hospital, respectively.
Several members of parliament support such a move, but they also voice concerns about operating more TCFs.
Will there be enough healthcare workers to run these TCFs given the overall tightened manpower situation in our hospitals.
This is something we can solve in the short term over a few months, recruiting, training them and putting them in place. Now that COVID situation has stabilized, borders are opening up, we have started our overseas recruitment process, as well as continue to work with our local institutions to bring in more healthcare workers.
The TCS, would there be a difference in cost because this would be run by private clinic? So if I'm a patient going to TCS, I would be concerned about the costs.
TCF costs no different from public hospital. We are running it and subsidizing it in the same way.
MP Liang Yinghua also asked if overwhelmed general practitioners could refer patients to TCFs as opposed to emergency departments. Mr. Ong says doctors shouldn't do so, as its facilities are not the same. Instead, they can look for urgent care centers, more of which will be set up.